It's time for an ICU shift recap, so let's recap this shift. Start off by getting a report from night shift. I was charged this shift, and it was very, very busy. After report, someone asked if I could come help them clean up their patient, so I did that, and then right off the bat, we got a new admission that I helped land and was in there doing all the things. Then a nurse called me and said, hey, I am super busy in one of my patient's rooms. Can you take my other patient to IR? So I took her patient to IR. And then we had to intubate someone. So we intubated someone, and then our tube station was down, so I had to go drop off some labs that were stat. At 10, a nurse called me and asked to help place an NG tube. We were just about to place that, all ready to go, and I was called saying, hey, you need to emergently go over to IR to do some mass transfusion. So MTP'd a patient and was over there taking care of that patient for quite a while. I wrapped up there, and we had a bunch of traumas that came into the ER, and I am not like the trauma responder ICU nurse at our hospital, but because there were so many, I went down to help out, so I was busy with that for a while, and when I wrapped up there, I broke our secretary for lunch. After I broke the secretary for lunch, I did an ultrasound IV on a patient, and I failed. So I got blood 3 times, and the vein blew every single time, so I had to have someone else come do it. It is what it is. It's just sometimes how it works. I was able to take a quick lunch after that, and actually I didn't even end up taking a full lunch because there was a code blue, so I had to go to that. And then after the code blue wrapped up, a nurse needed help withdrawing care on her patient. She had never withdrawn care before, so I went and just kind of helped with that. At 5, went around, got updates on all of the patients, and then there was a rapid response at 6. They didn't really need me, so I was able to leave, and a nurse asked if I could do an end-of-shift bed change with them. And right before I left, I did a central line dressing change because this patient's central line had been bleeding all day, and the nurse had been super busy and was trying to wrap up charting, so I said, hey, let me do that for you. And then I gave report and was out of there. And that was my shift recap.